Prolapse is a descent of the vagina or and uterus, i.e. the dropping of vagina and the uterus is called prolapse. It's very common, particularly in women who have had children and who have gone through the change. Prolapse happens because of the weakness of the pelvic floor muscles and the connective tissue around it. There are different ways of treating the prolapse, and it's not anything that is dangerous or serious, but it can affect your quality of life. And there's no reason why women should consider it as a part of being a woman. They should come and see their doctor and get it assessed and treated. Different women can have different degrees of prolapse and different types of prolapse. You can have either prolapse of the womb, uterus, or you can have the prolapse of the anterior wall of the vagina, which is also known as the bladder prolapse. You can have the prolapse of the posterior wall of the vagina, which is known as the bowel prolapse. You can have either only one of them, or you can have combination of more than one type of the prolapse. Posterior vaginal wall prolapse is a dropping down or descent of the posterior wall of the vagina. It is also known as the bowel prolapse because as the posterior wall of the vagina descends inside the vaginal cavity, the bowel also descends into the vaginal cavity. It can be very uncomfortable, particularly when your bowels are full. If the posterior vaginal wall prolapse is big, once you try to empty your bowels, you find the bowels, instead of coming out, it goes into this pouch. And some women put their finger inside the vagina to facilitate emptying of bowels, which we call as digitation to defecate. Posterior vaginal wall prolapse is caused because of the weakness of the pelvic floor muscles and is common in women with chronic constipation. Because when you are trying to open your bowels with the constipation, it pushes the wall of the vagina and causes prolapse. There are different things that you can do to treat the posterior vaginal wall prolapse. And the most important is to avoid constipation. Try not to lift too heavy weight, and if you are overweight, try to reduce your weight. You need to see your doctor if you are suffering with posterior vaginal wall prolapse, particularly if you are needing to put your finger inside the vagina to empty your bowels. It will get progressively worse if you do not put any action in place. The main causes of prolapse are: number 1, childbirth. Number 2 is menopause. Because of both of these reasons, because with the childbirth and with the change, the pelvic floor muscles and the connective tissue around it becomes weak. The pelvic floor muscles are like a trampoline that holds womb, vagina, bladder and bowels up. Once we have children or we go through the change, it becomes like a hammock. So that is how I explain it to the patients. The trampoline becomes a hammock, i.e. the pelvic floor drops down. As a result of that, the womb drops down and the bladder drops down and the bowels drop down, which we call prolapse. The other things that can cause prolapse or constipation. If you suffer with chronic constipation and you are pushing to open your bowels, that can again damage our pelvic floor and lead to prolapse. Chronic cough can also lead to prolapse, and if we are overweight, that can also cause prolapse. That is the first thing we need to do. If you have a prolapse and your weight is on the higher side, you are overweight, you need to reduce your weight to prevent the prolapse from getting worse and causing problems. The symptoms of prolapse are quite variable. They depend upon the degree of the prolapse and the type of the prolapse you have. The common symptoms that you can feel with the prolapse are You feel as if you are sitting on an egg. That is what women will commonly describe, that we feel like we are sitting on an egg, particularly towards the end of the day or if they have opened their bowels. You can also get dragging sensation in the vagina, fullness in the vagina, discomfort in the vagina. Sometimes you can have discomfort during sexual intercourse because of the prolapse. And if you have a bladder prolapse, you can have bladder symptoms, which can be difficulty in emptying bladder. You go and empty your bladder and you feel that you can't empty it completely. And once you have emptied your bladder, you get up and you dribble a little bit. That is because you haven't emptied the bladder completely because of the prolapse. Bladder prolapse can also cause frequency, which means that you go too often during daytime to empty your bladder. You go a lot during night also to empty a bladder. That can also be a symptom of prolapse. You can have urgency. When you need to go, you need to rush to toilet. That can also be a symptom of bladder prolapse. You can have difficulty emptying your bowels, particularly with the bowel prolapse, and you can sometimes need to push your finger inside the vagina to reduce the prolapse, to enable you to empty your bladder or to empty your bowels. Very occasionally, prolapse can cause bleeding when it's outside and it's rubbing on the underwear. Some women will have no symptom at all with the prolapse, and the prolapse is incidentally found during examination, particularly during the cervical smear. There are different ways of treating the prolapse, and it is not necessary that you will need a treatment. But I would suggest to see your GP if you suspect that you have a prolapse. They will discuss the treatment options with you. If your prolapse is not causing any symptoms and is not coming out completely, your GP will recommend you to do the pelvic floor exercises. That will not take the prolapse back, but it will prevent it from getting worse. If you are overweight, they will advise you to reduce the weight. It is only when the prolapse causes symptoms, they will offer you definitive treatment, which can either be a pessary or surgery. Pessary is vaginal devices that are placed in the vagina to hold everything up. They can be put in by your GP, or the GP can send you to the hospital to see a urogynecologist, the specialists in this field, to put a pessary in. Pessary has got hardly any complications, but it needs to be changed every 6 weeks. And if that is not the option that your doctor thinks is good for you, or if that's not the option that you want, then the doctor will send you to the hospital and they will offer you surgery. The surgery for the prolapses are quite simple and they are not very high risk, and you recover quickly from them, and the outcomes are quite good.